There's a fascinating detective story hidden right in the palm of your hand, a mystery of wiring and weakness. And today, we're going to crack the case of the ulnar nerve.
Think about it. Our hands are kind of like crime scenes. They're full of these subtle clues about what's really happening inside. They tell stories about the health of the nerves running through them. You just have to know how to read the signs.
Okay, so our first clue is this. Take a look. See how that little finger is kind of drifting away from the others? That's not just some random quirk. No way. That's a sign. It's a piece of the puzzle we're about to put together.
So that brings us to the big question, right? What secrets can our hands really reveal about the nerves inside? Let's dive in and start the investigation.
All right, so one of the most well-known clues you'll hear about is something called the ulnar claw. Basically, it's a resting position where the fourth and fifth fingers curl up and the main knuckles bend backward, or what we call hyperextended. It's a total classic sign, and it points us right to our prime suspect. So who is this prime suspect? Well, let's meet him. The nerve at the very heart of this mystery is the ulnar nerve. You might have even heard it called the musician's nerve.
And there's a good reason for that nickname. It's called the musician's nerve because it's like the master conductor for all those fine, delicate movements you need to, say, play a piano or a guitar. So you can imagine when it gets injured, all that intricate control is just gone.
So this here basically maps out the nerve's territory. And it's not just about movement. If you look at those highlighted areas, you'll see the ulnar nerve is responsible for all the feeling in your little finger and the side of your ring finger closest to it, plus that part of your palm, too. And here's the really crucial part. This one nerve powers a whole team of tiny, intricate muscles deep inside your hand. I mean, these are the muscles that let you do all the detailed work. So it makes sense that when they're paralyzed, we start seeing those telltale signs we're investigating. Okay, so if you're a clinician, how do you confirm your suspicions? You can't just glance at the hand, right? You have to run some specific tests, almost like a detective gathering hard evidence at a crime scene. First up, we have a test called Frohman sign. It's so simple, but absolutely brilliant. You just ask the patient to pinch a piece of paper, and then you try to pull it away. Now, a healthy hand, it'll hold on tight with a straight thumb. But if that ulnar nerve is weak, yeah, this is what happens. The patient's body compensates. It's amazing, really. They can't use that weak muscle that the ulnar nerve is supposed to be powering, so the body just recruits a different one that's powered by the median nerve. And that's what causes the thumb to bend super sharply at the joint like that. It's such a clever workaround, but it's also a dead giveaway of that underlying weakness. All right, our next test, this one's going to take us right back to that very first clue we saw. It's called Wartenberg's sign. Remember that little finger just kind of hanging out on its own? Well, this is it. A positive Wartenberg sign is when you just can't pull that little finger back in with the others. It just stays stuck out there. And why? Because those little muscles between the bones of your hand, the ones that are supposed to pull the finger in, are too weak. Okay, listen up, because this next part is a super common point of confusion. It trips up students all the time, so let's get it straight. The ulnar claw, the thing we've been talking about, you see that when the hand is just resting. Its look-alike, the hand of benediction, that's a sign of a totally different nerve injury, the median nerve, and you only see it when someone actively tries to make a fist. So remember, rest versus active, ulnar versus median. Big difference. But hold on, our mystery isn't quite solved yet. There's another layer to this. Another twist. See, it's not just about if the nerve is injured, it's about where. So you might be asking, does it really matter where the ulnar nerve gets damaged? And the answer is absolutely. In fact, the answer leads to one of the most fascinating and kind of weird twists in all of neurology. Let's break this down. A low injury, that's one down at the wrist, and it only affects the little muscles in the hand. A high injury happens way up at the elbow, and it hits muscles in the forearm and the hand. But, and here's the really strange part, if you look at that key sign row, the high injury, the one that sounds worse, actually results in a less severe-looking claw. How on earth can that be? Well, that, my friends, brings us to the final mind-bending twist in our story, the ulnar paradox. So here's the paradox in a nutshell. A more severe injury, one that's higher up the arm and closer to the body, it actually makes the hand look less dramatic, less deformed. It's totally counterintuitive, right? You'd think worse injury, worse claw. So what's going on here? Why does this happen? Well, in a high injury, a really important muscle in the forearm that helps curl your fingers, it's called the flexor digitorum profundus. That muscle gets paralyzed too. And since that muscle can no longer pull the fourth and fifth fingers down into that curled claw-like shape, the deformity actually looks way less obvious. So get this, the hand is actually weaker, but it looks straighter. Wild, right? You know, clinicians have this great little saying to remember this whole paradox. They say, the closer to the paw, the worse the claw. It's a fantastic mnemonic. It just means that an injury closer to the hand, the paw, is what creates that really dramatic-looking claw, even though the overall damage to the nerve is actually less.